Okay. Hi, Leah. My name's Susan. I'm going to be your nurse today.
Hi.
I'm going to go ahead and gather all my equipment. I have my stethoscope, pen light, otoscope, and I'm going to provide privacy, closed curtains, proper lighting, and I'm going to go ahead and do some hand hygiene, foam in. Leah, can you go ahead and tell me your full name?
Leah Carlisle, 51791.
Okay, and where are we today, Leah?
At my apartment.
Okay, and do you know what month it is?
It's March.
It is March.
Happy St. Patrick's Day.
Leah is oriented. She has clear speech. She is appropriate, proper hygiene. She's clothed appropriately. Her skin is pink, warm, and dry from observation. She can hear me. She has no flat affect, calm, compliant mood, and by observation, I can tell that Leah's nutritional status seems adequate. Let's see here. She's alert and oriented, like I said. She has appropriate eye contact when she speaks to me. Can you go ahead and grab my fingers and squeeze them? Pull me towards you. Push me away. Okay. Let's see. I'm going to feel for her radial pulses here. Palpable and equal. Leah, do you have any recent tattoos or piercings?
No piercings, tattoos.
Okay, can I see them? I see a couple here. Okay. They don't look like there's been any problems with healing. Have you had any issues?
No, they healed
This?
fine.
Okay. It appears that way. All right, go ahead and look at my nose. I'm going to shine a bright light in your eye. Look at my nose. Thank you. Okay, go ahead and look at my pen light and look at the wall behind me and back at my pen light. Good. Please follow my finger with your eyes. Here I'm testing for the 6 cranial fields and her EOMs for her eyes. Everything is intact so far. Good. Her eyes are perla. They're accommodating and they constrict appropriately. Let's see here. Leah, can you go ahead and take your finger and touch my finger? Touch your nose. Touch my finger. Touch your nose, touch my finger, touch your nose. Let's do the same thing with your other hand. Touch my finger, touch your nose, touch my finger, touch your nose. Same here. Good. Okay, no ataxia. Let me think here. There was something else. Range of motion. Oh, okay. Look at my nose. Tell me when you can see my fingers.
I can see him.
Okay, tell me when you see my fingers.
See him.
Okay, good. Keep looking at my nose. Tell me how many fingers I'm holding up.
2.
Tell me how many fingers I'm holding up.
1. 3. 1.
Okay.
2.
Okay. Leah's eyesight is intact and her peripheral vision is equal on both sides. I could also use the Snellen test if I needed. I would put the chart up in front of her, and she would read down the chart for me. Leah, do you wear glasses or contacts?
Just reading glasses.
Okay. Let's see. Okay, I'm going to go ahead. While I'm talking with her, I'm also inspecting her scalp, her hairline, her temporal lobes, her mandibular, her mandibular joints. Yeah, that's right. Face is symmetrical as well as her body is. Sinuses. Okay, we're going to feel for frontal sinuses. I don't notice any abnormalities. While I'm inspecting her face, I could also go ahead and check for midline for her trachea. Can you swallow for me? Okay, everything's intact. Go ahead and open your mouth for me. Say ah. Okay, she did have a tonsillectomy, when was it? 2006, yes. And I would also note that from her health history. And her uvula is intact when she says oral mucosa is pink and moist. Everything seems to be intact there. Let's see if I missed anything. All right, we will go ahead and move down to heart and lungs. So first I will go ahead and listen to her lungs. We'll do anterior and posterior. Anterior, we will compare both sides, right to left. Take a deep breath for me. Deep breath. And I would continue on all the way to the T9 post-axillary. And I would also do the back here. Oh, make sure that's still working. Okay. Listen to posterior lung sounds. Deep breath for me. And I would continue to listen, comparing both sides, post-axillary. Lung sounds are clear and equal bilaterally. And I will go ahead and listen to her heart while I'm still on the upper extremities. We will listen to the aortic, pulmonic, tricuspid, and mitral valve. Lung sounds are regular and strong. Let's see. Range of motion is intact from the beginning of the assessment, I can tell, and as she moves throughout the assessment. We could do shoulders. Roll your shoulders for me. Yep, that is intact. I checked her pulses. And I would have counted her apical pulse when listening to the mitral valve for 60 seconds. Let's see. We will move on to the abdomen. Can you lay down for me, Leah? All right, I'll have you lift up your gown for me. Thank you. First, I'm inspecting her abdomen. It is symmetrical and pink, warm, and dry. Let's see here. I don't see any lesions, scarring, bruising, no abnormalities. So we will go ahead and listen to bowel sounds. All four quadrants. We'll start in the right lower quadrant, then the right upper quadrant, move over to the left upper quadrant, down to the left lower quadrant. Then I'm also noting the color, skin color, pink, warm, and dry. I'm listening for bowel sounds every 5 to 30 seconds, which her bowel sounds are normal, active, and audible. I'm also inspecting her umbilicus, which is intact. No abnormalities there. Any tenderness, Leah, when I push? Okay. And also, I'm going to be palpating for liver or spleen abnormalities. I will have her take a deep breath, and I will do the right side. I'm checking for the liver. Go ahead and take a deep breath for me. Okay. Breathe out. Breathe in. I'm checking for any spleen abnormalities, palpation on her left side. I don't notice anything there. Do you have any abdomen tenderness or any problems going to the bathroom?
Nope.
Okay. Do you remember the last time you had a bowel movement?
This morning.
Okay, very good. Any burning or itching when you urinate?
Nope.
Okay, very good. Let's see. We will move on to the lower extremities. From what I'm inspecting, everything is symmetrical. Skin is pink, warm, and dry. And go ahead and bend your knees for me. They are bending. Push against my hands and pull your toes back to your nose. Good. I'm checking pedal pulses. And they are irregular and equal, and we'll be checking the popliteal pulses on the inside of her ankles in the posttibial. I'm also inspecting for varicose veins. I don't see any hair distribution. Nothing seems abnormal to me. Her circulation is good. I have a cap refill of less than 3 seconds. And I will also check for Babinski reflex. Go ahead and just relax your feet for me. And as you can see here, I'm stroking my pen up the lateral side of her foot and across her toes, and her toes fan, which for adults that is a normal finding. And I will do the same on this foot, and it withdraws, so that's good. Okay. Range of motion, all of that is intact. Palpable pulses. Leah, do you have any joint pain?
I do.
Can you tell me where your pain is?
My ankles and knees.
Ankles and knees. How long has that been going on for you?
Probably about 10 years.
Okay. All right. Is that from anything in particular that you know of?
I did ballet for most of my life. That's fun.
Are you able to manage your pain well from that?
I take natural anti-inflammatory mangosteen superfruits, and
Okay.
that seems to help.
Okay. Very nice. All right, Leah, I'm going to go ahead and have you sit up for me here, and I will have you face your kitchen table over there. Here I'm checking for any kyphosis. You can sit down for me. I'm checking for your spine, sclerosis, any asymmetry, which during the assessment I haven't noticed any. Go ahead and take a deep breath in. Shoulders rise symmetrically. Very good. And I'm also going to perform the whisper test, so stay where you are and repeat back to me what I tell you.
99. Apple.
Okay, and she has a normal finding. She can hear me through the whisper test. And let's see here. Do you have any numbness or tingling anywhere?
Yes, my right foot and
Okay.
ankle.
And that is from the nerve damage from what we talked about earlier with
Ballet.
ballet?
Mhm.
Okay. Okay. Let's see. Also assessed for deep tendon reflexes, the brachial radialis, patellar, and Achilles, which was here, brachial radialis, patellar knee, and Achilles behind her calf here. And I would also use my otoscope when I was focusing on the first part of her assessment. I would be checking her ears for any abnormal drainage. I know from the assessment so far she has no trouble hearing, but I would inspect the ear canal and the tympanic membrane. Okay, right side is good. I will inspect her left ear. Okay, everything is intact. Let's see, I think we hit about almost everything. So far, Leah has been age appropriate, and I would take note of everything during the assessment. Leah, do you have any questions for me?
No, ma'am.
Okay, we've completed a head-to-toe assessment, and I would refer her to the physician if it was needed. Thank you.
Thank you.